So hello everybody, my name is Marcus. I'm a urology consultant from the north of the UK, and today we're joined by a patient who has very kindly offered to give us a recount of his experiences with prostate cancer. So I was wondering if you could just give us your first name, age, and a little bit about how you were diagnosed and when you were diagnosed.
Hi there. Yeah, my name's Denzil. I am 50 several years of age, and my diagnosis was in September 2021.
Okay. And at the time that you were diagnosed, what treatments were you offered, and what made you choose the one that you did decide to go for?
Okay, so at the time that they gave me the diagnosis, they gave me the PSA level of 6.4, I believe it was, but a Gleason of 3 and 4. The 4 obviously being the aggressiveness of the cancer that I had, combined with the fact that out of 28 cores that they took during the biopsy, it was the cancer was in 18 of them. So it was more than halfway over, whichever way you slice or dice it. So it had, it was growing basically on the left and the right. Unfortunately, because of one of the factors, I should say, unfortunately, is my ethnicity, which, played a big part in the only 2 treatments that they were able to offer, which was either radiotherapy or a radical prostatectomy. For me personally, it didn't what actually happened during the consultation that I had with the surgeon, because radiotherapy treatment can, unfortunately, one of the side effects, confuse any remaining cancer to the prostate and the other parts of that area, meaning that a surgical removal later on may not be a possibility. In fact, there's a high, in my case, there was a high rate that I wouldn't be able to remove it. So really, it kind of only felt like I only had the one choice, and the one choice was, let's get rid of the cancer. If the cancer comes back in that area at a later date, then I can go down the radiotherapy route. So I didn't really feel like I had much of a choice. However, it was important that I had a choice.
Okay, yeah, I totally understand where you're coming from there, Denzil. It's not an uncommon situation to feel that way, I think. Certainly, it sounds like you had a high volume of a kind of intermediate risk type of prostate cancer. I like to kind of refer to it as amber on the traffic lights. You weren't in the best camp, you weren't in the worst camp. You were in the middle ground where you had some choices, but perhaps because of your particular landscape of the prostate and maybe a little bit more about you as a person, the doctors looking after you felt that surgery was your better option. And certainly that's part of our job, isn't it, to try and guide you, but the decision, I think, does have to be your own, which is great that you felt you had that choice.
Yeah.
What did when you first kind of were in that clinic room and this was in front of you, what were your main anxieties then, having kind of chosen surgery? Obviously, nothing is perfect. There's pitfalls with everything. What kind of risks really mattered to you going into that situation?
Well, to be honest with you, I mean, this is not my first time at the radio of cancer. I have actually been treated with radiotherapy and chemotherapy in the past. So actually, I for me personally, I didn't have any fears or anxieties around that in itself. However, with the actual surgical removal, the surgeons and clinical nurse staff, people that I spoke to before my surgery, I'm part of the Walnut group, which is also part of Metro. So it's a support group for gay and bisexual men, although others are welcome into the group, to discuss both pre and post surgery. So having had the opportunity to actually attend that group and hearing other people's experience of their radical prostatectomy journey, I really didn't have that many fears going into the surgery itself. It was, have been explained to me that it was all done by a robot that would be completely anesthetized and everything else. There wasn't anything about the surgery in itself that I found scary. The only bit that I really was, I had trepidation about was knowing that I was going to have to wear a catheter. The idea
Mm,
of the catheter really didn't appeal to me at all. But, you know, I was told, you know, and I've spoken to a few people who get told the same thing, you know, it'd only been for 7 days. Of course, the
yeah.
moment I woke up from the surgery, it was, no, you're going to have it for 2 weeks.
Oh
By
dear.
which time,
Okay. Yeah.
by which time it's too late to object, isn't
Yeah, it
it?
is. Yeah, that's it's really reassuring that you felt that kind of confident, I guess, or reassured going into the operation, because I think, and I would agree, a lot of the anxieties patients have tends to be about treatment regret and decision regret. And I think once you've decided, I'm not for surveillance, I'm not for radiotherapy, I'm going for surgery, often I think there is a kind of a bounce in people's kind of confidence about what's going to happen next, because you sort of, you're committed, you're thinking, well, just got to get through this now. Although saying that, obviously, incontinence, catheterization, and sometimes erectile dysfunction do later on kind of become things which patients say, well, actually, I was quite worried about that, but I thought, let me just get over the cancer bit first, and then see. And I've got family members who have had prostate removals, and yeah, they said the catheter was probably the most challenging part, and so I've heard it from patients and family, so I
Yeah.
can totally get that. But it sounds like you did really well, Denzil. So just moving on then, when you just before the operation, we often tell patients to do things like pelvic floor exercises. We might tell people to get into shape. If they've got a little bit of extra weight, can you lose that a little bit potentially? Particularly for the robot, because we have got to kind of tilt your head down on the table, so we need you to be a bit trimmer. What kind of advice were you given that was lifestyle related or exercise related, or were you given none?
The only thing that I was asked to add in to my routine was the pelvic floor exercises,
Okay.
which I started doing straight away as soon as it was mentioned to me. And I guess post recovery, the first few weeks after the surgical removal, they were really useful. Having done them in advance, it was useful that that area down there was, the muscles were as strong as they could have been. um I've always been very active in the gym. So the only thing I couldn't do, I was told to avoid riding the bike and stuff like that, obviously, because that area is what, that's one of the things that actually aggravated my PSA level and triggered the tests anyway. Yeah, no, I was just told but basically the only thing that I was told was to kind of avoid red meats and to do the pelvic floor exercises. So those were only two things. I really do lead quite a healthy
Yeah.
lifestyle.
I mean, we've not met in person, Denzel, but looking at you via the computer screen, I can tell you're obviously, a healthy man in good shape. It doesn't surprise me. And it's interesting you were told about the dietary changes, because that is really becoming a kind of hot topic. The avoidance of red meats and dairy, and trying to be a bit more plant based, especially with prostate cancer and these hormonally driven cancers. So it sounds like your team were very forward thinking, which is nice to hear. And the pelvic floor exercises, for anyone out there listening, absolutely, that is really crucial, and it's good that you got good conditioning before the operation. It sounds like you gave
Yeah,
yourself
yeah.
a
The,
good
the,
chance.
the flip side of it was though my personal journey. After the operation, 3 to 6 months after the operation, um, I actually found the pelvic floor exercises encouraged the incontinence, so I actually stopped doing them. So it's really important that people know that everybody's body is slightly different.
Mm,
And of the support group where I go, at least 3 or 4 out of 25 guys have found that actually the pelvic floor exercises induce the incontinence. So we stopped doing them after a while.
okay. That's interesting. Yeah. Well, like you said, everyone is different. We do need to treat people as individuals for sure.
Yeah.
Did you get a chance to meet a clinical nurse specialist, and what sort of role did they play for you?
I didn't get a chance to meet anybody face to face, but I certainly had them, at the end of the telephone. And coming out of the surgery, the first couple of days, I did lean on them quite a bit. If I felt that something was wrong with the catheter, I was on the phone to them. And they were very reassuring, very comforting, gave me the options, gave me things that I could do. Just tips on how to, keep it clean, stop it from, the any excess fluid leaking out from
Mm.
crystallizing and stuff like that. So yeah, they're very, very supportive, especially a clinical nurse by the name of Fee. She was always very, very supportive.
That's excellent. It sounds like you had both network support groups and obviously having a supportive cooking specialist. I mean, you know, you need a team around you, I think, when you're going through these sorts of times in your life.
Yeah,
So
absolutely. And part of that team has to be, you know, peers, has to be people that are either going through it or have already gone through it.
yeah, yeah, no, I would completely agree with you wholeheartedly there, Denzil. So you sort of touched on it earlier. You got home, you're caring for your catheter. Quite often, the CNSs, as we call them, including the specialists, will help with catheter care. The nurses on the wards are often very well versed in this. It's not just the catheters, is it, Denzil? There are other things sometimes to juggle. Were you offered the blood thinning injections?
I was not offered the injections. Yeah, it because I'm quite fit already, and I recovered quite well from the actual surgery itself. That they didn't think it would be necessary for me to do the injections. So yeah, it was just about looking after the catheter. And with that said, one of the good things about the catheter is I didn't have to get out of bed anymore to pee. You know, going into the surgery, I was getting up 4-5 times a night sometimes, you know, to go to the toilet, and coming out the surgery, just being able to relax, you know, look over at the night bag, make sure it was filling up, and being able to go straight back to sleep again without having to get out of my sheets. That in itself was it was the only positive side of the catheter, I have to say.
Yeah, well, you've got to find the positives.
You've got to find the silver lining.
Silver line.
Absolutely.
Absolutely. You took the words out of my mouth there. Brilliant. So, one of the things I'm, as a surgeon, always cautious of is allowing patients, should I say, allowing is maybe not the right word, but having patients who've had this operation, especially in the early days, getting constipated, because it can put strain on the new join between the bladder and the urethra and the penis. Were you given laxatives, or were you kind of just advised to drink plenty of water? How was that side of your care managed?
Okay, so the hospital team advised me to take the laxative, which I believe it's a sort of crystal form that you then add to water. I went down a different route, and I went to a local pharmacy and bought liquid version. I think it's lactulose. Bought a liquid version, and I basically overused it. What I wanted to do was actually avoid constipation in any way, shape, or form. And without being too graphic, basically, when I had to use the bathroom for number twos, I did it in the shower. I was
Right.
so liquefied that I was, you know, I didn't have to sit down on the toilet to do it. You know, and you just give the shower hose down afterwards, don't you? And
Yeah.
I know that's not for everybody, and some people might be grossed out by that, but that was just my personal journey. Having to
Yeah.
sit down on the toilet with this catheter in was the most uncomfortable thing that, you know, I could have put myself through. And for some reason, I couldn't find an adult booster seat for my toilet to actually, you know, to elevate me to a position that wouldn't alter the shape or the direction of the catheter, if that makes sense.
Yeah, that's really interesting. Yeah, it's not a problem that anyone's ever disclosed to me before, but I can completely imagine that as an issue. Maybe that's an Dragon's Den invention, Denzil. You know, maybe that's what you need to go. So, I mean, so this takes me on to the final couple of questions, really. If you were to do it again, obviously you're not going to do it again, and God forbid anything similar, but what would you say could have been done better or might have prepared you better?
For my personal journey, I think it was I think it was just about right. They hit the spot just about right. I was fortunate that I was put in touch with a support group, because they gave me information that the hospital didn't. So before the surgical procedure, before I'd actually had, back then everything was done over, you know, over video, over Zoom. The consultations, the pre-preparation, the videos that we had to watch. We had to do an hour and a half seminar to prepare us for the operation itself. And if you didn't attend the seminar, you didn't get the operation. It was as simple as that. What the support group gave me was a piece of information that initially I was heartbroken by, but I was so glad that I had it in advance before I had the seminar and everything else. And that was that the operation itself was going to take place by having 6 holes in my stomach rather than going through the same area that the biopsy took place. In my head, I thought they were going to go through the between me down there area. To find out from people that had gone through it that I was going to have 6 holes in my stomach, I was glad I had that information. I was heartbroken. My abs have always been, one of my better aspects, if you like, when I look at myself in the mirror, something I've always been very proud of. And knowing that I was going to have to try and recover those and that was going to be scar tissue did actually affect me a little bit more than most of the other elements of the operation. So yeah, just I would say to anybody considering going for the prostatectomy is please arm yourself with all the information of exactly what's going to happen to your body.
Yeah, wow, that's incredible advice, because that's not something I would have really thought about. As a surgical trainee, you're told, you've got and this is, where gender bias comes in, I guess, but you're told, you've got an 18-year-old lady, so, make sure you put the stars out of visualization because they might want to go on a beach one day. But actually, gosh, a 50-year-old man might be just as conscious about that. And we probably don't think like that at all, I think. And so that's, you've taught me something this morning, Denzil, there, I think. So thanks for that.
You're welcome.
All right. I mean, so final question. You've already sort of said it, golden tips or trick bits for people going through this procedure. Is there anything else, any other golden nuggets that you'd give? Or is it just digest all the information and take your time?
Yeah, no, really, for me, following the rules of the diets after the surgery, making sure I went for walks, a little bit more every day. I went for a walk, really actually helped. It helped stimulate the whole area down there, and because straight after the operation, while the catheter's in, you can't do your pelvic floor exercises. It's just you shouldn't. You absolutely shouldn't. But what you can do is make sure that the muscles down there are activated just by going for walks. Just for each individual, go as far as you can each day and a little bit more the next day. If nothing else, it gets you off the sofa and out the house. So just doing that, I had no complications whatsoever, apart from a couple of times where I thought maybe the catheter was blocked. It wasn't. It just needed to be readjusted. Not to panic, to rely on the team. That's what they're there for. I did get given an emergency number. I only used it once. Because most of my issues happened during daylight hours, so I was able to call straight into the team rather than use the emergency number. And just get as much support as you can from any support group that might be available to you wherever you are in the country.
Yeah, absolutely. I think I would reiterate all of what you've just said. I think you've come across as an incredibly brave and very generous patient to do this, Denzil. One of the final things I'll say is, as a surgeon, I always try and do a lot of drawings for my patients, lots of diagrams, just to explain. We can sometimes take it for granted that patients know where the prostate is or what the prostate does or what's around it, and so just really taking the time. Don't be afraid. Anyone out there who might be going for this operation, quiz the surgeon or quiz the nurses about that little things, because it's your time and you've got to get it right.
Okay, yeah, that's absolutely right. So my last word on it would be, because the way that my surgery happened, I would encourage people, if you're going to have the surgery, before the anaesthetic goes in, ask for an epidural. It really helped me for the first 6 to 8 hours after my surgery. It really did help. Other people don't, that haven't had that, really felt the pain and had to have a lot of pain meds. Wake up straight away and have pain meds. I didn't have to do that because of the epidural.
Fantastic. Excellent. Well, thank you, Denzil, again, once more.
No,
Thanks
thank you.
and thanks everyone for listening.